Hello Reddit. Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? I volunteer at an prisoner shoved a ballpoint pen up his urethra to get out of being stabbed. Ike insisted he had no idea how it got there. We spent hours deliberating how to get it out, and he just reaches down, still in his handcuffs, and pulls it out himself. This one is sad. From my old roommate. Girl had a very large lump on her breast that she didn't tell the doctors about. She actually went to the hospital for migraines, saying they were getting increasingly bad. When they found the lump, they asked why she didn't say she had that. She said she knew it was going to kill her eventually, but she just wanted to get rid of the migraines because they giving her a lot of pain in her last months. It's well known in the that a patient with something stuck up his /her/etc, but has no idea how it got there, or they fell on it. The weirdest thing I saw was a patient who came into the ED with a shampoo bottle up his butt. So, what brings you into the emergency room tonight? I shoved a shampoo bottle up my butt, now it's stuck there. No shame. When was their last meal? They think they can fool their PET scan, end up losing money, time and over irradiated. That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of their instructions instead of saying to read the details on the sheet. There was a woman sent in by her family doctor for urinating some blood. We put a camera into her bladder with her awake, looking to exclude a tumor. We found her bladder full of citrus seeds/pits. So many of them. When asked why she put them there, she said "Well, I eat a lot of fruit and wouldn't accept any responsibility for them being there." Had a patient refuse to admit he swallowed a pen, even though an x-ray showed the pen in his small bowel and we took the pen out during an emergency surgery. Had an elderly lady from a nursing home come in super altered. She would wake up briefly to answer questions, but then would be out like a light seconds later. Usually in this case we assume it's from infection, stroke, etc., but we still ask about drug use, legal and illicit, since it can cause that kind of thing. Lady denied several times she didn't take anything other than prescribed meds. Finally, as we're about to intubate her, put her on a ventilator, since she was getting worse, we cut off her bra, and out pops a little baggie with some white powder and a baby straw. We gave her some Narcan, and she gasps herself awake. Even after that still took her a long time, before she said, "Well, maybe I did take some drugs from a friend." Since then I've trusted no one when it comes to denying drug use. Once had a woman come in for a possible yeast infection. On exam she had a glass bottle stuck in her vaginal filled with urine. Totally wouldn't admit it was hers, or explain how it got there, even after we removed it. Just kept saying, "I think this is all a joke, and you put it up there." All the symptoms of pregnancy plus 2 positive pregnancy tests. There's 0% chance I can be pregnant. I'm not married. To be fair, the patient's mother was there and this was in a very conservative country. She ended up admitting she was pregnant when we separated her from the mom. Other than all the random things that end up in rectums accidentally, drunk electrician with the longest drill bit I've ever seen sticking through both legs and impaling his scrotum in between like a really gross kebab. He was so drunk he thought he broke his hip. Denied owning any drill bits or for that matter having been drinking. Most common are the numerous drug/tox screens we do that come back positive for something and everyone is shocked, borderline offended it got into their system. I can literally smell the smoke on your clothes and breath, see the nicotine stains on your fingers, and you're trying to tell me you quit smoking 10 years ago. I'm a court tech, and I was to scan a woman's abdomen for belly pain. She and her girlfriend were there. I have to have a pregnancy test. I have to have one done. I can't radiate a fetus. I even ask none, so no exceptions. She denies up and down she's pregnant, and then, after the test I did, it said she was. She denied it, and demanded a blood test, since she was a lesbian, and never has sex with men. Well, the blood test came back positive also. Surprise. And the argument that ensued was biblical. She was arguing with her girlfriend and the nurses and the doctor. I never ended up scanning her, and they chalked up her pain to her being pregnant. The look on her girlfriend's face when I said it came back positive was one I will never forget. I'm a nurse, not a doctor, but it's amazing how many patients lie about how much they drink. Dude, we aren't judging you. We just want to know if we need to worry about you detoxing when you come out of open heart or any other surgery. Not a doctor, but my husband. He had a 17-year-old girl with abdominal pains come into the ER with her mum. Turns out she's in full-blown labor. Assures them she can't be pregnant. She's a virgin. The baby is literally crowning right there in no maternity ward in their hospital. And she was in advanced labor when she arrived. And she still insists she's a virgin. Edit. Poor wording. My husband was the doctor, not the 17-year-old girl. Not a drive, but worked in a hospital for a long time. Had a part come in that had odd on heroin. Was able to get him set on that front. However, he had necrotizing fasciitis in his pectoral from injecting there. He was septic and honestly a bit of an asshole. He kept trying to tell us the reason he was there was because of a motorcycle accident. We all knew, but he was in absolute denial. He eventually heals up and transfers out after a couple months. He came back about 6 months later to say thank you to all of us and to apologize for all the lies and churlish behavior. Seems it was enough to get him out of that life and onto a new one. I think about him now and then and hope he stayed clean. They were almost 60 years old and taking a drug to make them lactate so their husband could pump them as it would help their fibromyalgia. Took a while for them to admit why they were taking it. Had a patient in hospital, I forget what for. The point is that he disappeared for a few hours. When he came back he was tachycardic to 160 BPM, massive pupils, couldn't sit still. We asked him what he'd taken while he was out. Nothing, he swears. He went to the pub and just drank lemonade. Okay, we say, we're gonna take some blood and find out what you've taken. He then pipes up say the friends he was with would think it was funny to spike his drink. What? We asked. Did he think they might have spiked his drink with speed? He says. What do you know? Bloods confirmed that he had taken speed, but he insists he didn't take it. His drink was spiked.